So next up on our agenda is a Tribal Data Modernization Implementation Center fireside chat. So we are going to invite up to the stage Amanda Franklin, who is Senior Partnerships Manager at the National Network of Public Health Institutes. And then also joining us to moderate this chat is Sarah Price, Associate Director of Public Health Policy and Programs at NHB. Please join me in welcoming Amanda and Sarah.
Hi, everyone. Can you hear me okay? Perfect. So we've talked a lot about how data has been particularly challenging, and public health data is really to find tribally informed resources for public health data has been a huge challenge, not just IT wise, but the data sovereignty aspects, the legal aspects, a really big curve that tribes have to overcome. So that's why we're really excited to have Amanda here today, because with support of CDC and NPHI, the National Network of Public Health Institutes is standing up a tribal-specific data modernization implementation center. This is really a key initiative to bringing more funding and assistance to the tribes to work on that public health infrastructure. So Amanda is going to tell us a little about that today, and I have a lot of questions for you, Amanda, to learn a little more. So just this is one of a few implementation centers. Can you just tell us a little about the Data Implementation Center program overall?
Absolutely. Good afternoon, everyone. Happy to be here. So the Public Health Data Modernization Implementation Center program is funded by the CDC as a part of the Public Health Infrastructure FIG grant. For this portion of the work, there's about $255 million budgeted. The goal of the Data Modernization Implementation Center program is to support public health authorities with their adoption of the latest health IT standards and connecting with health information exchange centers. So as part of that work, the National Center for Public Health Institutes, ASTO, the Association of State and Territorial Health Officials, and FAB, the Public Health Accreditation Board, make sure I get all those out correctly, are the national partners. And we have selected CRISP, Shared Services, Guidehouse, and Mathematica to serve as the implementation centers for state, territories, and freely associated public health authorities. And we are currently finalizing the contract with Chickasaw Health Consulting to be the Tribal Implementation Center program supporting tribes and tribal serving organizations. And that's an official announcement, but not really. So the contract is still in the works, but we are working with Chickasaw Health Consulting.
And it's really exciting to have an organization that understands tribes, and that I know that was a really key part of how you made these decisions. Can you talk a little about how the Tribal Data Modernization Implementation Center differs from the others and how it will address the specific needs tribes face?
Absolutely. So the state, what are those? State, territories, and other implementation center is working. They're currently prioritizing electronic case reporting and connecting to health information exchange networks. I'm sorry, I'm not really a data girl, so putting all the words together is hard. But so for the tribes, we are hoping to meet with the tribes to see what your data needs are. We know they will be different. Some will look for electronic case reporting, but that's not always the case. So we're hoping to really get information from the tribes and tribal serving organizations who are doing the work and who are the experts in this field to help us decide, help us help you. So that is really the plan, to prioritize tribes, the tribal input on how and what projects we need to focus on.
Yeah, that's great. I know we've talked a lot about how that flexibility is so important for tribes. And I know that you're still gathering data from the tribes, doing a lot of that outreach. Can you talk about some of the programs that you're thinking about that might be offered through the center? Projects, I should say. Some of the projects tribes might be doing.
Absolutely. So while while there is priorities on electronic case reporting and health information exchange, there are also other projects that we're hoping to work with tribes on. Those projects, while we are unsure, because we're definitely still we're working to create a tribal, a group of tribal experts that will help us determine what those use cases are, what those projects can be, and we're doing that. The name of the group has changed, so we're just going with Tribal Expert Working Group. But that's one of the places where we're looking for tribal input to kind of help us move this work forward.
As we've talked a lot about today, tribes vary pretty widely in how they choose to exercise data sovereignty. So some tribes may not want to do this work directly. They may want to work with state and local partners. Others may form consortiums. Some might work with their tribal epidemiology center. So there's a lot of flexibility. Can you talk about how NMPHI and the FIG national partners are addressing this and how you're considering flexibility as you design this modernization center that's specific for tribes?
Yeah, that's very important, and we really want to hear from tribes. As I said, we are we there will also be conversations that the Tribal Implementation Center will be having with tribes more directly, that will help us understand how to better respect tribal sovereignty as we work. Sorry. We really are hoping that through this project, we create collaboration opportunities that allow for us to respect tribal data sovereignty, but also to ensure that tribes have access to work with the folks that hold their data. So the better way of saying that is, in this work, a lot of the data is held in different spaces. So we really want to make sure that while we are truly partners in this work, so that we're making the space for the tribes to be the experts and to be the ones holding and pushing this work forward. So we're just hoping to really just kind of be a conductor in a way, because there's a lot of conversations, there's a lot of things going on in data that doesn't always necessarily put tribes first. So we're really taking the time to put tribes first in this space so that we're really giving you something that you can work with, that you are proud of, and that it's something that we can hopefully sustain into the future during all of these times, these trying times.
I think a lot of people also know that, up until now, FIG funding has not really been available to tribes. So this is a really great opportunity to start tapping into that infrastructure funding and having more long-term support for building those systems. Can you talk a little about what the timeline's looking like right now for when tribes will be able to start onboarding for these projects, receive this funding, work with the center?
Absolutely. So the Chickasaw Health Consulting, we're finalizing that contract, and we are hoping to engage the first initial tribes and potentially techs in the summer, so summer this year, and then we will continue to have onboarding of tribes and other tribal serving organizations throughout the fall of 2025 through the fall of 2027.
That's awesome. And I know that we're going to be working really closely together. So plug for listservs, sign up for NMPHI's listserv, sign up for NIHB's listserv. We will both make sure all that information gets out as we learn more about the timeline too. Me and Amanda email each other a lot. So we're staying on top of this.
Yeah.
In general, grants can be really challenging for tribes. And we know this is like many other funding opportunities. It's a necessary evil. We have to get funding out through grants, but that does lead to issues with long-term staffing, IT gaps, and then, capacity issues. So while we understand this is necessary, it might lead to some instability to do these short-term data projects without a long-term plan. I know you're still in the planning stages, so I just want to ask if you could talk a little about what you all are doing to, first of all, make sure that this grant application process won't be overly burdensome for tribes so that tribes, no matter what their capacity is, will have this access. And then also what kind of advocacy you are all doing to make sure that there's a sustainable plan so that tribes who do this work can continue this work beyond the period of this implementation center.
Absolutely. So the grant application project for any person, any organization is extremely, extremely difficult. That's why my role as a partnerships manager, this is kind of my bread and butter. I believe you really need to customize those projects to meet the needs because the goal is to get fundings to tribes. So making it overly burdensome from administrative things prevents the programmatic folks from moving things forward. So it's very important for me to make sure that we're producing a grant application process that truly allows for us to move things along quickly, but also in respect to all of the, I know that during the CMS presentation, they were discussing about how long that application process is and how the deadlines. So we're really being mindful of how building timelines that are actually realistic, but do move the work forward. In my nervousness, I missed to plug the opportunity to speak about the fact that we are partnering. So we are partnering with NIHB. We are partnering with CSTE and several other organizations to really help us connect with the tribe EPI community, the tribal data community, and all of those things. So we are hoping that through all of these partnerships, we're learning things that help us increase the chances of sustainability. Sustainability is what we need, especially in the data space, to continue to impact and improve the public health of tribes and the people, really. So while each of the partners that we work with, each of the implementation projects that we do, the Tribal Implementation Center will be focusing on how to incorporate sustainability into those projects so that we can really build something that lasts the test of time.
Oh, this is so great. And I'm glad you plugged that partnership because I do think, that's one of the things we learned from COVID is that funding was really helpful in the short term, but it was really, really challenging to get short-term funding. And that's why this data modernization work is happening is those challenges during COVID. So I'm glad that everyone's keeping sustainability in the forefront so that we don't have those challenges. We have just a couple minutes. This is, a nice venue to get to ask questions. I know that this is all new, this implementation center. And there's been a lot of calls about it, but this is kind of a chance to, in a smaller setting to ask questions if anybody has. Go ahead, Colin.
Hey, not exactly a question, but just an opportunity for a semi-shameless plug. Since this conversation is relatively short today, but as Amanda mentioned, CST has also signed on with this initiative to try and support the community of practice as tribes and tribal health organizations sign on and promote their data modernization projects. And related to that, we have our conference coming up in June in Grand Rapids this year, and are offering kind of a full pre-conference day workshop that's going to be focused just on the Tribal Data Modernization Implementation Center. So, big thanks to NNPHI for supporting that, but, that will be a whole day opportunity to talk more about this, about what potential projects could look like. We've had some forerunners that are really, pushing at the edge of what these could look like. Our colleagues at Tule River in California or Turtle Mountain in North Dakota that have been making efforts to connect their tribal health systems to ECR and get access to health data that, their tribes have never had before, just to name a couple. So if you've never been to CSTE, come join us. It's great. But we'd love to have folks there and are really pleased to be able to offer this opportunity. So early bird registration is open now. Apologies for, piggybacking on your event to promote ours, but felt it was a good chance to jump in and mention that that's happening. Thanks all.
And I think we have time for just one more quick question, but obviously you can find Amanda after as well.
I will be here today and tomorrow.
You might not be the right person to ask this, but I wonder if there has been any movement at the federal level in data modernization to make existing surveillance systems work better for tribes. Because we already collect so much data, and if we were able to, at a national level, make it work for tribes in a way that it doesn't now, that seems like a good solution to me, at least, with the caveat that I don't work for a tribe. So that's all.
Yes, no, thank you for that comment. That's very important. A very important point to bring up. So we are keeping that in mind. And while I am not the right answer, I can't speak for the federal government and how they continue to collect data. I will make sure to communicate that back with the team that we do communicate with so that we are actually, doing things that make sense. Can't collect data forever and ever and ever and ever and ever.
I know we are at time, and this was a really short presentation. We're going to be working with NMPHI to help facilitate tribal feedback. So please again, sign up for our newsletter so you can join and give that feedback. We have our data modernization learning community, and our goal is to work with NMPHI to help them so that the center could be responsive to tribal needs and address some of those issues where these systems aren't designed for tribes by having at least help navigating the system while we do our advocacy on our end to try to improve these systems as well. So